Hello, I would first like to thank IFS for inviting me to share with you our expertise at the Fertility and Sterility Society in Egypt. The Fertility Society is the first subspecialty society in obstetrics and gynecology in Egypt, and it was established on the 30th of May, 1994. Uh, I'm going to share with you our experience at the Egyptian EFFS, the challenges which we faced, and access to fertility service in Egypt, and how Egyptian Fertility Society is working to improve the fertility care in Egypt. The society started by the three founding members, Professor Mohammed Fayyad, Professor Samir Sawi, and myself. The Egyptian Fertility Society is a democratically elected society governed by the elected executive board and general assembly. The objectives of the society are first to promote communication between the gynecologists and other related disciplines interested in the field of infertility, to promote communication between the society and other related national and international societies, to encourage courses, meetings, congresses, and research in infertility, to adopt and disseminate ethical guidelines in the fertility care, and to issue a regular journal in the field of infertility. In 1994, the society started by 22 founding members, including gynecologists, andrologists, public health specialists, ethicists, and patients groups. Today, we have more than 1,400 registered members. However, the paying members are only just above 600. People don't like to pay. We have to launch the society in Egypt by holding a couple of meetings in the various governorates of Egypt to announce the birth of the Egyptian Fertility Society. And we prepared for our first international meeting, which was held in the year 1995 in Cairo, and it was attended by the Minister of Family and Population and the Minister of Health of Egypt. Again, because of infertility is not only a medical problem, but it is a socio-cultural problem. So we had also to invite to the activities of the meeting the Minister of the Social Solidarity, because infertility is a medical, socio-cultural problem, in addition, of course, to the Minister of Health. We had to introduce the issue of ethics in application of infertility treatment, and that's why we held a number of meetings on ethics in collaboration with the FIGO Ethics Committee on Human Reproduction, the International Association of Bioethics, the International Islamic Center for Population Studies and Research, and it was attended by various ministers like the Minister of Family and Population. We also collaborated with the HRPRHR program in Geneva, Professor Pino Beningiano, the director of the program, who attended some of our meetings as well. In the year 2005, we held the annual international meeting of the society in collaboration with the 6th International Conference of the Royal College of Obstetrics and Gynecology, as I was the head of the representative committee of the Royal College at that time. And this meeting proved to be an excellent meeting attended by more than 2,500 members from 54 countries from all over the world. Also, we had to keep ties and relation with the Mother Society of Obstetrics and Gynecology. Here, the Professor Nabila Fakin, the president of the Egyptian Society of Obstetrics and Gynecology. In the year 2019, we celebrated our 25th anniversary of the Egyptian Fertility Society. And we held a large meeting, which was attended by a large number of participants and by over 40 international faculties from all over the world. In the year 2007, the presidency of the society was handed over to my colleague, Professor Samir Sawi, and then I took over. I was elected in the year 2009 as the president of the society. The current board of directors of the society include a representative from various universities, from Professor Ahmad Sharkani from Ain Shams University, Muhammad Yahya, Al-Azhar University, Ibrahim Mahrous, Imad from Alexandria University, Abu Bakr from Benha University, Salama from Nufaya University, late Hussam Sabit from Asyut University, and Professor Sherbini from the Ministry of Health. So it is representative of the whole medical body in Egypt, not restricted to one country. Now, the activities of the society include holding its annual international conference in Cairo, but also pre-congress workshops on prevention management of infertility, hysteroscopy and hysteroscopic surgery, laparoscopy and laparoscopic surgery, HRT, ultrasonography, family planning, and assisted reproductive technology. But also we held sessions at international conferences of IFFS, FIGO, SIWID in various cities of the world, including Munich, Montreal, Rome, Barcelona, Singapore. And in addition to the annual Cairo meeting, we arranged around 4 to 5 local conferences and workshops in the various government areas of Egypt. So don't restrict our activities only to Cairo. We also started hands-on workshops on assisted reproductive technology in collaboration with the ART unit at Al-Azhar University. And these workshops are attended by Esri, Professor Paul Devroy, by IFS Jolie Simpson, by Yaqub Khala from St. Thomas's, and by Klaus Dedrich from Esri, and Felicia Petragia from Civil Society, the Society of Endometriosis and Uterine Disorder, and other international faculties. And we also issue a journal. In January this year, we issued the 51st issue of the Egyptian Fertility Society journal. The society became a member of the prestigious international IFS, and had a seat on the IFFS board, executive board. Dr. Serour was Assistant Secretary General for 3 years, and then Secretary General for another 3 years. In the society, we keep collaboration with other sister international societies, including IFFS, ESHRI, Wales Society of Endometriosis, FIGO, the Society of Endometriosis and Uterine Disorder, EPCOG, International Menopause Society, ASRM, European Society of Gynecological Endoscopy, EGAL, the Royal College of Obstetrics and Gynecology, WHO, but also we witnessed the birth of the African Federation of Fertility Societies when we discussed its constitution in Cairo in the year 2005, in the year 2009, and the federation was launched in the year 2020. Egyptian expatriates who are working in the various parts of the world, like Canada, UK, North America, and Arab countries, and various parts of the world, they all come to the meeting and provide support to the society. We faced a number of challenges in Egypt in providing service for infertility, for assisted reproductive technology. Also, one of the problems we faced introducing ART in the public sector and implementing low-cost IVF and medical assisted conception, and helping the Ministry of Health in outlining guidelines and regulation for ART practices, and also finding good funds to encourage research. And lastly, of course, we face the problem of the COVID-19 pandemic, which really forced us to organize our meeting in the year 2020 completely virtual, but really we made good support, good IT support for the meeting, and the meeting went on very well with participation of more than 30 international figures from all over the world, and it went on very well. Last year, we held a hybrid meeting, which was attended by a large number of participants, but also a number of international faculties, and another number of international faculties participated in the meeting virtually. We had 34 scientists from all over the world, from IFFS, from ESHRI, from ASRM, from various universities all over the world, and from Arab countries. And indeed, it was one of the most successful meetings of which we have had. We are now currently preparing for our 28th annual international conference, and I do invite you all to participate in this meeting during the 24th, 25th of November 2022. I can reassure you that we are inviting a large number of international faculty to participate in this meeting. So what is the current access to fertility care in Egypt? As we have seen, the society started more than 25 years, now 28 years, and we really worked very hard to introduce the concepts of treatment of infertility and the ethical issues and the guidelines and advanced technology. Of course, the various lines of treatment available, like medical treatment of male or female, hormonal treatment, conventional surgery for male or female, laparoscopic surgery, microsurgery, minimally invasive surgery via laparoscopy. They did not meet resistance concerning ethical issues or religious issues. But of course, art was the big problem. The was introduced in Egypt since the early 70s at Al-Azhar University and Al-Suyuti University, and then through the Johns Hopkins Program for International Education of Gynecology and Obstetrics at Al-Azhar University in the year 1976, and at Alexandria in 1977. And through these programs, we trained more than 800 obstetrician gynecologists from Asia and Africa and from all over Egypt, and to spread the art of laparoscopy for treatment of infertility. Also in the year 1980, with the Johns Hopkins Program for International Education of Gynecology, the art of microsurgery, and we trained a large number of gynecologists from various African countries and from Egypt. Laparoscopic surgery, of course, was introduced, but robotic surgery is not popular in the treatment of infertility in Egypt. ART was introduced in Egypt in the year 1986 when we started the first IVF center, and then the first baby was born in the year 1987, and then later, and that was at a private center. Later on, other private centers started, but still, till today, there is unmet need of assisted reproductive technology in Egypt. If we assume that 1,500 cycle is the minimal requirement per 1 million population per year, and if Egypt is 100 million population, then we need 150,000 cycles. What is actually available in Egypt now is around 60 to 70 cycles, but many of these people, they don't undergo a second cycle or third cycle if the first cycle fails to have pregnancy. But Fawza and myself had shown that a large percentage of couples paying for ART out of their pocket, as the situation is in Egypt, they, after having the first IVF cycle or the second IVF cycle, they stop having more cycle if they did not achieve having a baby. So in spite of the fact that 60 to 70,000 have ART, yet some of them, they do not achieve having a live birth because of financial costs. So we have to work very hard to reduce this cost by encouraging establishing ART units in the public sector and the Ministry of Public Health in the year 2000, and then at the Al-Azhar University in the year 2004, and then of course in the other universities. The first unit established at the Ministry of Public Health in the year 2000, and then the unit at Al-Azhar University in the year 2004. And they started its training program as it became one of the biggest unit in Egypt. It started its training program in the year 2007, where we trained more than 500 obstetrician gynecologists and embryologists from 12 African and Asian countries and from all over Egypt. And this was possible through convincing the political policymakers that infertility is a disease and is associated with disability. And consequently, we have to encourage application of assisted reproductive technology for infertility treatment. And we have to remember the words of Fathallah, that if couples are urged to postpone or widely space pregnancies, it is imperative that they should be helped to achieve pregnancy when they so decide. So with this, I'd like to say thank you very much for listening, and good evening, good afternoon, and have a good day or a good night. Thank you.